Welcome to the Board of Health meeting on December 27th, 2021 at 5:30 PM. Can I have a roll call, please?
Gavin Byers.
And Chris Nosella. Additions or deletions, Carla, I do not believe we have any, and we do not. All right, we're gonna move some stuff a little
Nope,
bit.
I'm sorry, Rick, I think just said something.
Rick?
Yeah, I've got a couple, so, one was just a quick, budget discussion. If we can add that, Carla, just so I can update the board as far as Neshoba goes.
Sure.
And then 78 Turner Road, we have the transfer request.
Okay. You're absolutely right.
30 Sauna Road, did you put that on another agenda?
I believe that's on the 10th.
Okay. And then the
Is
last
that you?
one was just a quick update on 5 Turnpike Road, Unit 220.
Okay,
Okay.
okay. So we have 78 Turner Road, Unit 220, update, and the other one was, I'm sorry?
78 Turner Road for transfer,
Mm-hmm.
and then the budget discussion.
Budget, thank you.
Yeah. How you
Okay.
guys wanna charge me more money because you can't keep Littleton?
Not exactly, no.
Okay.
Okay.
All right, just making sure. Okay, so we're gonna move, our appointment hearings, we're actually gonna move to, 1.4, 19 Sauna Road, septic upgrade and well variance.
Where would be the best place?
Anywhere that camera can see you, and that we can all see. Does Jim have any of the paperwork for this, or?
He has, Jim, did you see the paperwork that I had sent you this morning?
I did not.
Okay, you do have, a letter that says what the variances are, as well as a regular sized plan. I apologize with the holiday, I just didn't get the email until, this morning. In the future, we will be much more diligent with getting you full-size plans down in Florida,
Okay.
okay? Thank you.
All right, please proceed.
My name is Patrick Burke, I'm a civil engineer with Places Associates, representing the proponent, the useless. We are upgrading a septic system and installing a well, 19 Sauna Road. We had met previously early during the summer with the board to go over the situation with the skinny yard. We've got Vinton Pond.
I was gonna say, this is the one that's, I think there were two houses next to each other or something, real
No,
close, or?
we're the abutter. That was-
Oh,
that was
oh,
this
okay,
house.
okay.
We're the abutter to the
Yeah.
east of that.
And you are the little skinny one?
Yes.
Okay, I remember them, yes. Go
Is
ahead,
that the
Jim.
one we requested a Title V on, because she didn't know where the system was?
Yes.
No, a
No.
different property.
Well, hang on. Rick?
That's 22 Sauna Road, it's a different property.
Oh.
It's a different property, okay.
Okay. So go ahead, please.
Yep. So with the location of the lot and the septic systems located in the area, existing septic systems, existing wells, we had come to the conclusion that we looked at putting a conventional system in and also an alternative system in. And there was only a small area up here on the side to site the system, and there wasn't enough room for the leaching area. So we came to the conclusion that the best situation would be to put a tight tank in.
Okay.
So we designed a 2,000 gallon tight tank with alarms that flows by gravity from the existing home to the rear of the yard. And that complies with Title V. We just need, with the upgrade, we need permission to provide the tight tank.
And
It
you're-
complies with all the setbacks from the foundation, property lines, and the wells.
So did you have the variance for the,
The variances is for the well.
okay,
So
explain that to me.
we've got a 100-foot offset to the well.
Mm-hmm.
And we will be going back to conservation either for a notice of intent or an RDA, because we're within the 100-foot buffer zone. But the local bylaw, there's a 25-foot setback to the road, which we're gonna need to reduce by 5 feet. We're also gonna need to reduce the 25 foot to the property lines on both sides.
How wide is your lot?
So we're 28 feet, so we're
Yeah,
a little
okay.
bit more than 28, so
Yeah.
we need to reduce it to 14 feet, and that's
Yeah.
our variance. Recently, Rick just notified us too, there was no records of this, with the town or with Neshoba, with the neighbor's, cesspool out here, we believe it's a cesspool. And originally we had thought it was in this yard, but it's actually, we need to reduce the 100-foot setback to 64 foot from a well to a cesspool.
Okay,
And we went out and located that in the field, just last week.
okay. Jim, I'm gonna, try and fill you in on this as best I can.
I heard part of it already, so go ahead.
Yeah, just the lot is very skinny, so they're set back from property lines for the well. It looks like the well is dead center in the, property, so, you know, I don't see a problem with that, because otherwise they would not be able to put water on this property.
Now, this is where the tight tank is going? This
Yes.
is the tight tank plant?
Yeah, the tight tank is how far apart? I can't see.
100 feet from the well.
100 feet from the, tight tank.
101 feet, yes.
101 feet from the tight tank to the well.
But
Okay.
actually, it's more. This is the 100-foot setback, so it's probably about 140 feet. From the well.
140 feet, which is fine, because it's a tight tank. It's a 2,000 gallon tight tank, has alarms, everything, so they'll know when to pump it. And, you needed a setback on this or no?
Nope,
No,
we're good
so
with the tight tank.
they're good
for
with the tight
setbacks,
tank,
everything.
so they're just basically looking for the variance on the well.
Okay, now, they're gonna put risers off of that, 2,000 gallon tight tank, so it's a convenient thing to get through for the pumper?
Yes, there's gonna be risers, to within 6 inches of grade.
Okay, so they come up flush with the lawn?
It's directly in back of the
Now,
house.
he wants to know if this is flush with the lawn.
Yeah,
Yes, it is, Jim.
the risers will.
Okay, so the risers are gonna be flush with the lawn, so it's easy access for the pumper to get in. All the bells and whistles for the alarms are gonna be set, everything is okay, you're 140 feet from the well to that tank?
That's
Yes.
correct.
Okay, in my opinion, I think it's a go.
Okay, that's kind of what I was thinking. Gavin, do you have any questions?
Yeah, is that cesspool in use on the other property? Because that would be, that's the real variance, is that one.
To the well, yes.
Yeah, is
That-
that, so
that's-
that one's in use?
That's actually 2 properties away, is it not? This is,
Yes,
this is,
it's 2 properties away.
yeah. So basically, Jim, what they're looking at is a variance for the well to, we're not really sure if it's an active cesspool, because it's 2 properties away,
How many feet?
60.
60?
That's correct.
Okay, we gotta remember that with a tight tank and all this other stuff, even the well, but everything is sealed up, there's no infiltration of water like we have with the old hand-up wells.
Right.
It's a different ballgame. So
Yeah.
this is an artesian, right?
Is it, how deep is your well?
We haven't put it
They
in yet,
haven't
it'll
put it-
probably be
yeah,
250 feet or
Yeah, it'll
something
be an
like that.
artesian. It's
Oh,
not-
it is
it's not
artesian,
done.
okay.
Yeah.
Yeah, okay,
Yeah,
so that won't be a problem.
yeah, that's good.
Okay. Gavin, you good
I
with
just
that?
wanted to make sure he knew that
Yeah,
that was the setback.
Yeah.
Is for that cesspool.
Very
not-
good.
Not the tight tank.
do you have any other questions?
I'm good with
No?
that.
All right, can we get a motion to approve the tight tank and well with the setbacks?
And can I just?
Oh, hang on, go ahead, Rick.
It'll just be, conditional on the sign off from Conservation Commission on the, interdepartmental referral form, we're still waiting for that.
Okay, all right, so we'll move that. Carla, you have that?
I do, I just
Okay.
need someone to motion.
So,
So I'll make a motion to approve 19 Sauna Road with the tight tank and the tentative well placement, with the condition that,
Conservation.
Did he-
Conservation Commission approves the well location.
Yes.
okay. Can I get a second? I'll second. Second, okay, all in favor?
Alright,
Aye.
Aye, so moved. Okay, so you're all set.
Thank you for your time.
Thank you.
that's
You're
all you
welcome.
need me for now?
That was it. I think Rick has Rick, you have anything else on septic?
So just, a couple of meetings ago, we had approved a permit for, 78 Turner Road, and there's a new owner now, so it's just a request to transfer it into a new name.
Yeah, that's a no-brainer.
Yeah, that's easy.
Motion.
Can we get a motion, Jim, to, accept that?
Make a motion to accept that, yes.
All in favor?
Aye.
Aye,
Aye.
so moved. Okay, Rick, anything else?
Unit
That's it, septic wise.
That's it, septic, so we can let Jim go? Carla?
It's up to Rick. Do you wanna let Jim go?
That's up to you. I mean, if he wants to continue, then he can. Otherwise, you do have two members and you can continue.
All right, Jim, thank you. Have a good night.
All right. Talk to you soon.
All right, bye. All right, Jim's gone.
Okay, so you do have Jenna Montgomery here.
Hi, Carla.
Hi, Jenna, it's so nice to
All
officially
right,
meet
this
you.
is, this is our,
1.6, so I know
Okay.
that Rick probably would want to be on the line at the same time if you wanted to take Jenna.
yes, we can. I think COVID we'll get COVID eventually.
So,
All right, Jenna, please, introduce yourself, let us know who you are and why you're here.
Okay, hi, good evening. I am Jenna Montgomery. I'm the Communications Specialist and Public Health Educator with Neshoba Associated Boards of Health. They brought me on late September, early October, with an overall goal of just trying to improve the communication of the organization with the 16 towns we work with at this point. My background is clinical social work. I also grew up in Townsend. I lived here till I was 18, so this building is not unfamiliar to me at all. Serious throwback. And my parents still live here, so I really care about this town a lot, so it's kind of cool to be here in this capacity at this point. In terms of some of my work so far, I've been working with the Healing Communities Study. I don't know if you guys have heard about them. They've been working in Townsend and in Shirley. They've already put a drop-in center in over next to McNabb's for people dealing with mental health and substance abuse issues. Yeah.
I don't know what that is.
Yeah, so it's through NM Cares. So Boston Medical Center got all this money from the federal level to conduct studies in high-need areas. I guess Townsend and Shirley were identified as high-need areas. I know Chaz Sexton-Durnian has been pretty involved with the Healing Community Study. That's actually how I met him and started working with him a little bit. He's been in it for longer than I have. But yeah, so the overall goal of the study is to reduce the opioid overdose death rates in the towns that they are in by 40% in a 3-year period, which is very ambitious, but also really good. So
I hope that works.
I sure do too. It's a big problem. So I've done a lot of work with people who are battling active addiction or at various stages of their recovery. So I think that that's a really important issue, and not only that, the grant money I was hired with by Neshoba, that grant places a really heavy emphasis on issues of equity and justice, and I think that people with substance use disorders in this corridor that Neshoba serves, like there just aren't as many services in this kind of area for people struggling with those issues as in other parts of the state. So it'd be nice to bring some of that in here. That's kind of the goal. So there's been a little bit of that. I do the COVID-19 data sheets that you guys get from Jim on Fridays or the weekends whenever he sends them. I've also been looking for additional grant money for the agency, see if we can maybe get some more services going. I've been doing some really basic communication stuff, like making distribution lists that are more current and up to date than what Neshoba originally had. I think I've got the contact info for you guys down pretty good. I think I've got a pretty good system going, but if it's not working, just tell me and I'll fix it. Been kind of connecting with the councils on aging a little bit and getting to know them a little bit better. Letting everybody know about our vaccination clinics. I think Carla might have gotten an email from me about that today.
Oh, we talked a lot today about it.
We sure did, yeah.
On board, I actually have all the new data where you have several new clinics.
Yep.
So that is
Yep.
also posted
We're
on the
doing
website now.
one every Wednesday in January is the plan, and we'll see what we do after that. But we've got
all
enough.
the shots available?
Just Moderna.
Just Moderna.
Only Moderna, yep. I mean, we'll see, that could change later down the line, but for now, that's all that we've been able to get from the state, so.
Okay.
Yep. Other than that, just getting to know our public health nurses a little bit, working on the website. Got a COVID-19 page up on the website that I'm going through every week to make sure the links are up to date, because I don't know if you guys have been trying to keep up with mass.gov, but the links sometimes, yeah, right,
Yeah.
exactly. So trying to keep that up to date. So if you need a place to link to with current COVID information for townspeople of Townsend, feel free to link to that page on the Neshoba site. Like I said, I'm keeping it up to date. So if something's not up to date, you can call me and yell at me and say, Jenna, fix this. And then social media, trying to post on there at least once a week. The January 5th COVID-19 booster clinic, I advertised on social media, and it reached over 2,000 people in like less than 12 hours, and like the clinic got booked up like immediately.
Oh, great.
I
Fantastic.
could not believe when I got your email this morning, because I didn't look on, I
Right.
didn't read the emails on Friday, Saturday, and Sunday.
Yeah.
And it was booked Thursday afternoon, and we put it up, what, Thursday morning?
Yeah,
And it was
Yeah.
booked,
it was
so-
wild, yeah. So this round I'm holding off on social media because I don't know that we necessarily need quite that much reach, but it's good to know that we can get it, so.
Are you, can I, not to interrupt, I'm
No,
sorry.
please.
Are you working with the state?
In the sense that they do a local Board of Health webinar every Tuesday for all of us to kind of sit in on. I don't know if you guys are in on that at all.
No.
3 p.m. local Boards of Health webinar. And they just give us like an hour-long update on all things COVID and otherwise that
They're
are
still
relevant.
not giving us any help with advice or recommendations?
In terms of specifically anything? Yeah,
Anything.
no, not
They've
really.
just abandoned the entire state.
Yeah.
It's nice to know.
That's rough, yeah. I think that they're not doing as great a job communicating stuff with everybody as they could be. And I do wonder if, I mean, you guys are all so busy, this is a volunteer position, you have full-time jobs, et cetera, but I wonder if maybe, if I can get you guys the information on that webinar, if having somebody sit in that might be helpful at all. Because they also give you, they send out an email after the fact with a bunch of resources and links and slides and stuff that has been helpful for me in my capacity, but then again, I'm not interfacing with a whole entire town, so I don't know
Right.
would necessarily.
I know that we're all working and 3 o'clock is not a good time,
Yeah, exactly.
you
Yeah,
know?
yeah.
And,
Well, I'd be happy to jump on it,
Yeah.
but.
I have it in one ear while I'm doing something else usually anyway.
I always thought, and this was a year ago, that there was only a certain amount of lines that were available, and Jim Griffey was kind of listening for all of the area and then was gonna communicate with people, and that was happening, but that was also a year ago, so maybe things have changed, and if I'm able to get online, I certainly will.
Yeah, let me.
For us, I think that's
Mm.
That
important.
would be handy.
That would be
WebEx
very handy.
state
Okay, so
Yeah.
I will do that,
to
Okay,
Carla.
a couple of notes or something that,
absolutely.
you know, the board
Right.
can take a look at or something would be great.
And the slides are great. So once you get into like their list and they give you the slides, you can then send them to the other members and it'll be just like this nice,
Absolutely,
well laid out information.
all right.
Very good.
Otherwise, what I get from the state is those data points
Mm.
in a big mess, and I pull them individual points out by town and put them in a nice little sheet for you guys, but
Yeah.
that's really it.
Yeah, so do you remember any of the numbers other than Townsend, or? Just curious, I mean, like Pepperell or Lunenburg right now?
off the top
If
of
you-
my head, I
If you don't,
don't.
that's fine.
And I couldn't get on the internet here. If I could pull up all my files and show you, but yeah, I don't remember offhand what everybody else's numbers are. That's another thing. Do you specifically want percent positivity rates, cases? What would you like to compare to? And are there specific towns you're
I think
interested?
positive cases would be a great thing to have.
Okay.
I mean, Rick does a great job with us. If we ask him, he gets anything we need.
Yep.
But you know what, like I said, we sometimes get busy and forget to ask the questions,
Sure. Yeah.
you know? If you're doing the reports that Jim sends,
Yep.
that would be great if you could include surrounding towns.
Sure.
that are members of Neshoba.
So I'm guessing you're probably not interested in like Berlin.
No, I'm just thinking probably
Ashby,
Ashby,
Pepperell.
Townsend, Pepperell,
Abutting communities,
Lunenburg.
anyone that's abutting
Yep.
Townsend,
Yep.
Yeah,
maybe
I'm
Yeah.
sure you have no idea what
Templeton.
Brookline, New
Yeah.
Hampshire is doing.
Yeah,
I don't, unfortunately.
Do you do Templeton?
I get enough information.
No.
from them.
No? Okay, sorry, we can't find out
They're
the kids
hassling
are gonna
me.
live in that.
Sorry. Yeah.
It's all right.
I could do a tutorial on how to use the COVID dashboard though. It's pretty snazzy.
Yeah, I've been looking through some of the state data on the state website,
Yeah,
so it's just, super time consuming,
it is. Yep,
that's all.
it is.
Oh, cool.
Yeah.
Anything else,
Rick,
folks?
No, not
Gavin?
really, yeah.
No,
Yes,
yeah, I know Rick's still there. I don't have any more questions for you. I think, welcome to the community.
Welcome
Again.
back.
Again,
Yeah, again.
Thanks.
And, we appreciate what you do,
Great.
you know?
Well,
And,
feel free to reach out. You guys have my contact info, so if anything comes up after the fact,
No
don't
problem.
hesitate, okay?
thank you
All
very
right,
much.
thank you
Welcome.
very,
Thanks,
very
Jenna.
much.
Great to
Very
meet you
much.
all.
Yes, wonderful.
Okay, Rick, are you still there?
I am.
Excellent, let's go to COVID update.
All right. So we'll just kind of start with the numbers like we do every time. So this is the one that Carla had received today. December 23rd was when the data came out. So Townsend increased from 83 positive cases over the previous 2-week period to 90 cases. That was 12/16 to 12/23. The percent positivity rate also increased to 11.52% from 10.39%. Middlesex County increased their positivity rate to 4.15%, up from 3.61. And the state also increased the percent positivity rate to 5.66% from 4.97. As far as vaccinations go, there really wasn't a significant change in the numbers. We had seen that 5 to 11 year age group growing pretty quickly. This week it increased by 2%, both in the individuals that got at least one dose and fully vaccinated. And right now Townsend sits at 72% that have received at least one dose and 65% that are fully vaccinated. I wanted to, Jenna already mentioned the COVID clinics that Neshoba is doing with the Moderna boosters, so I think Carla got the rest of those dates today, so you guys can post those. We also have the clinic coming up on January 6th from 3 to 7 over at the Townsend Library Senior Center. That'll be kind of the follow-up to the first one we had done in December, so we'll get second shots to the people that have received their first, and then there's a lot of people that have been signing up for booster shots again. And for that one, we are offering any of the vaccines, so Pfizer, Moderna, Johnson & Johnson, they are all available.
For what clinic was that, Rick?
That's the one that's we're doing with the Community Health Connections
Okay,
on January 6th.
okay.
Wow.
And
Yeah.
then the state did release some data on breakthrough cases. Do you guys want me to go through that, or is that's something that you guys have already seen?
You can go through it, I'd like to hear.
Yeah, go ahead, please, Rick.
So I'll just read maybe the first paragraph. I think it gives a good summary. So today, the Massachusetts Department of Public Health released a review of breakthrough COVID-19 cases in vaccinated Massachusetts residents and found that nearly 97% of all breakthrough cases in the Commonwealth have not resulted in hospitalization or death. Additionally, the review found unvaccinated residents are 5 times more likely to become infected than fully vaccinated residents. 2 doses of Moderna or Pfizer or 1 dose of the Johnson & Johnson would be what they consider fully vaccinated. And unvaccinated residents are 31 times more likely to become infected than fully vaccinated residents who have received a booster. So they're starting to look at that data, and it's a pretty big difference. The review also found that 99.9% of breakthrough cases among fully vaccinated people under the age of 60 did not result in death. Among the breakthrough cases for residents over age 60, 97% did not result in death. No deaths have been reported in breakthrough cases among those under age 30. And then the rest is just a summary. But essentially it says that the vaccinations are working. They might not necessarily protect you from getting sick. A lot of times they are, but if they do happen to have a breakthrough case, the vaccine does seem to do a pretty good job of keeping the person from at least having severe symptoms.
All right, one question. Do we have any idea if these 90 cases that Townsend has are Omicron or whatever the other cases are? Do we have any idea which ones they are?
So I think we talked about it before, but state isn't passing along any community level data as far as the different mutations go. So we don't have that information specifically for Townsend. I believe I read something last week that said something like 76% of the cases right now are Omicron. And Delta is back to, but we don't get that on a individual community level. It's provided on a state level.
Okay. Does Neshoba have, how do we put this, Jesus? Do they have any recommendations about recommending that we put full masks back into all public buildings? I mean, when do we decide to do this? I mean, Rick, you know we're more than double
Yep.
than we did when we had masks, and we're not getting any guidance from the state at all. They're kind of just leaving us out here.
It did do some guidance for you. It's an advisory again, which is kind of similar to what they had released back in March, I think it was. So this was the winter advisory regarding face coverings, and it was updated on December 21st, so just recently. And it essentially says that the recommendation, regardless of vaccination status, would be to wear a mask in indoor public locations, so basically anything besides your house. And again, it's an advisory, so it's not an enforceable your regulation or a mandate. It's a strong advisory, and Neshoba isn't necessarily gonna recommend that you go that route. It's ultimately up to you guys, and we can provide you with any data to support a decision or to inform you so that you can make that decision. But the state is kind of, it doesn't seem like they're gonna be going that mandate route again, and that they just updated their advisory for anybody vaccinated or unvaccinated to wear a mask indoors.
So when did the state decide that they just didn't care anymore?
Well, I guess when they got rid of all of the
Federal money?
There's still federal money out there. It was really just when they got rid of, I forget what they called them, but when they had all the requirements for different types of businesses and who could and couldn't operate and what requirements they had to meet in order to operate, those standards that the state had come out that the Department of Labor and Standards was enforcing, and we were enforcing for them as well. But when they dropped that, they really haven't had any intentions of going back and doing anything similar to that again.
Wow. Gavin, what are you thinking?
I'm just listening.
You're not thinking?
Yeah, I'm thinking.
I'd like to know what you're thinking.
I think the position of the state is that they're telling people what to do to protect themselves. And it's up to the individuals to either get vaccinated or not get vaccinated, because that's what's gonna keep deaths from happening. If people don't wanna get vaccinated, the state doesn't wanna get into a position of telling people that it's mandatory. City
Yeah.
by city, that stuff's happening.
Yeah, well,
And-
that's our concern. I'm disappointed the state feels that way. They've always been good to us in the past. And they're just leaving us out to hang, to just look and piss everybody off.
I think it's become a point finger match politically with who's vaccinated and who isn't, and the state doesn't wanna get involved with telling the cities.
My concern is that we're now up to 90 cases. We're heading in the wrong direction.
Yeah.
And our job as the Board of Health is to protect our citizens.
Yeah, I feel like
People don't give a shit. They just, I walk around, I wear my mask everywhere I go, you know, in stores or whatever, and, you know, I do my part, you know. It would be pretty hard for me to put that sign up there that says we, you know, recommend that you wear your mask, and I
Sure.
don't do it,
Sure, yeah.
you know? Most people don't, from what I see, and God, I hate to be that guy that just sits here and says,
Last week, I think it was, we had talked about kind of what some of the other Neshoba towns were doing and what they had decided. And the only change that I'm aware of since we had talked about that a couple of weeks ago is AIR issued basically something similar to what the state did as far as an advisory that strongly recommends the use of masks. And they did distribute that at least to the downtown businesses. So if you were interested in doing something like that, where we kind of didn't go with a mandate if that's what you're reluctant to do, but issued another strong suggestion for masks, and then went another step farther and delivered.
we already have that on the signboard, Rick, and nobody's paying any attention.
Haven't got the individual businesses to try to get them on board and put signs up that basically say, we recommend you wear masks. I mean, it's still gonna be up to people. I don't know if you're gonna make, a huge dent in people who aren't wearing them to get them to wear it.
Is Neshoba gonna send out all these notices to all these businesses?
They went out and they delivered them.
Are they gonna do that if we ask them to?
I can get, somebody from our office to help me out with it, yeah.
Okay, what do you think, Gavin? Just a recommendation to the businesses to try and get people to wear masks? That's our next step, I guess.
Yeah, I mean,
It's only a recommendation.
yeah. As long as businesses know what a recommendation is and know that it's not
Yeah, it's not
a
mandatory.
mandatory
Right.
thing, I mean, Air's a little different, they have a downtown section that people walk
Mhm.
from one business to the next that's kinda tight. There's some restaurants and
Yep.
things going on. We don't really have that.
Right.
Yeah, I guess I'm thinking more like,
But we also have a supermarket that 3 or 4 towns use.
the Woods Plaza, that
Yeah.
strip where, McNabb's and Townsend Pizza are,
Yeah.
the gas stations, those places, and then the food service establishments. Might not get everybody, but at least kind of the higher traffic ones.
Yeah. Well, I would like to see you do that.
Okay.
I actually wanna hear from Gavin if he's good with it too, cause we are a board and it
Yeah.
isn't just me.
Yeah, I think, again, I think we should look at it and see what the language says and then,
Yeah.
see, and give it, if it's high traffic areas, restaurants, grocery store, like
Hardware
McNabb's,
stores, McNabb's,
the gas stations,
yeah, the restaurants,
if we recommend
yeah.
for them as individual business owners and operators to recommend
Yeah.
to their employees and patrons
Mhm.
to wear a mask, I think that would be a good thing. It's not
Mhm.
gonna hurt anything, certainly,
It's a good first step.
yeah.
All right, Rick, can you write something up and get it to us, and so we can read it and before it's sent out?
Yep, I'll do that, and then, I don't know if Carla, maybe you could help by putting together a list of businesses.
Absolutely,
You have something already, but,
I do.
yeah, together, and I can get it distributed, if you can come up with kind of a list where you'd like to get them to.
Sure, I can have that to you by noon tomorrow.
Okay.
Okay.
Okay, anything else on COVID?
The only other thing I had was Ross had sent an email to the board. I know Chris and Carl, I'm assuming you guys were the ones that kind of came up with an answer for it. But did you want to talk about any more if Townsend received at-home testing, how they would be distributed?
I had a conversation with Eric, the building inspector, and Ross this morning about if the Board of Health wanted to recommend to Ross to solicit to the governor, asking if we could get on that list of the cities and towns that get the free test kits, given the fact that are such a high rate. He's concerned that if we get the free test kits, how are they gonna be distributed? Rick, would you like to talk about what you found for the other towns?
I went out and looked at the websites and tried to find news articles about how the towns that did receive ended up distributing them, and pretty much every one that I found, it was they were offering each person 2 test kits, and they had a window of time where they could come to the town hall or other town building to pick them up, and they had to show ID to prove residency in the town. But that's what it seems like most of them were doing. Obviously, it would probably matter how many test kits came to towns, and then who you were trying to get them to. But when you start trying to really pick a particular group, it tends to get tougher. Because you have to collect a lot of information on each of the people really. So yeah, I think that it seems to make sense, and it's fair, and if you got them, I would just stress that they're for people that truly need them, and can't go out to the store and get them themselves.
So
But
when,
I think it is a good tool. The other part is that the federal government is going to have a program where they're going to offer 500 million home test kits, and you're going to have to make a request through the federal government to get those. They haven't really provided details, but that's supposed to be coming sometime in January. And then I also believe on January 15th, there's supposed to be an announcement from the federal government as far as health insurance reimbursements for at-home test kits.
Is Neshoba gonna contact the federal government and request them?
So they have to be requested by individuals.
Individual towns or individual people?
Individual people.
Really?
Yeah. And I think that was probably just a way to weed people out, because 500 million test kits in the entire United States is not a whole heck of a lot.
There's 330 million people in this country.
Yep.
500 million should be more than you need.
Maybe
That's more than one per person.
for one test.
Yeah.
So maybe.
I'm just throwing that out there. It's
Yeah. First, I think it's small, but
Yeah.
I guess.
we had
initially talked about the fire department where we were looking at the mobile clinics, and this was, I think, before your time, Gavin, when Chris and I were looking at the emergency dispensing sites, remember?
Mhm.
And we
Yep.
needed a mobile vaccination place in the
Yep.
fire station, and that was when Chief Boynton was here.
Mm.
I have not talked to interim Chief Shepherd, I do have an email to him, but it seemed like that would be a really, the most efficient place, and you could literally have the people drive through and show proof of identity and just hand them, you don't need a nurse, you don't need,
Right.
I mean, I could do it, one of us could do it.
Yeah.
You could set up a little tent and just have people, but it's important, and I agree with Rick. If you start looking at who are the people that need them first, okay, so then do you go to Karen and say, okay, well, who are the people that are over 75 and who are the people that can't, and then to the fire department and the police department, who are the people that you know that can't get out? And then do the nurses have anything like that, Rick?
We probably have some sort of a homebound list just from our homebound vaccination program. But Karen might be a better resource to identify more people.
I thought that was probably the first place. So we left it at that point was, it looked like the fire station was a good idea. It looked like there was staff that would be capable of handing these things out. In your email, you mentioned that it was 2 kits per family, correct?
Yeah, that's what all the other towns that I had seen had done.
Okay. So what I think Ross is looking for, if the board pleases, is some type of an agreement that you'd like to talk to the selectmen, or to let Ross know that the Board of Health is supportive of him trying to solicit the governor to get free test kits for Townsend.
Well, I think by order of the way things work is we talk to Ross and he talks to the selectmen.
Would you like to talk to Ross tomorrow?
I will not have time. I
Okay.
can promise you I will not have time.
And that is why I suggest that maybe I could send him an email saying that the Board of Health spoke today and is supportive of him going forward in investigating how to get free test kits for Townsend.
Absolutely.
Okay.
Yes,
All right, let's do that.
okay.
Okay.
That will help.
Okay?
All right, Rick, do you have anything else for us?
Yes, he does.
That's all I've got for COVID anyways.
Okay,
220.
all right, 220?
Yes.
So just wanted to update you on this. This is the one that, the apartment at Country Estates that we were trying to get a administrative search warrant for. So I kind of figured out what's been going on. Adam had filed for the administrative search warrant in the housing court, which is in Lawrence. They had assured him that it would be a fairly streamlined process. And so he had taken all the information that I gave him, wrote up a template that they had used in the past to the same type of warrant, and delivered it to the housing court. They said that they had to review it, and they would get back to him. And they did review it. They got back to him and essentially said that there was not enough information to issue an administrative search warrant. And the standards that they were using to try to determine whether one could be issued or not was for a criminal search warrant, which is obviously very different. And Adam really wasn't too pleased with the court. So he gave me kind of option B, which was to take the same paperwork that we've already prepared and go to Air District Court to try to get an administrative search warrant. And he actually has already called the clerk magistrate
She's
there
out there.
and spoken to them. They seem open to the idea of issuing that, and it seemed like the paperwork that he had put together would suffice for them. So right now, we have scheduled to go to the Air District Court on Thursday, January 6th, and hopefully leave with an administrative search warrant.
Excellent.
So wanted to update you guys where that stands right now.
That's excellent, because I put that on the agenda for the 10th.
Okay. So
Very
yeah, we
good.
should have an answer, hopefully by that time.
Excellent.
Wow. I cannot believe that we asked for an emergency search warrant, and we're, how many months out now?
It was in September, I believe, that was stuck. So, yeah, I mean, that's what I told him, and he, couldn't disagree that, it seemed a little ridiculous for what should be kind of a pressing issue, especially where we're enforcing the sanitary code, which is health and safety violations. So I think we were in agreement that we were gonna stop working with that court and move in another direction.
Yeah. You said they're housing, right?
Their housing court, which is who we would typically deal with, for, kind of the normal housing code issues. If someone were, issued an order and chose not to correct, that's who we would file with. But I know the district courts do issue the administrative search warrants before, and it just seemed like, something that particular court hasn't dealt with a lot. He pulled out a file with Adam, and it had something like a half a dozen cases in it, and those were all the administrative search warrants that they had issued in the past 12 years, I think he said. So a pretty small number of them that they've dealt with, and he, at least in his opinion, they seem to be applying a standard that doesn't really apply to what he was seeking.
Okay. But we will be getting this in.
That's the hope, is that, according to him and his discussion, that, magistrate, if everything's in order, hopefully we'll be leaving the court with that search warrant that day.
If that doesn't happen, what do we do?
I'll bring it back to you on the 10th, and we'll, you have to figure out where to go.
Okay. Thank you. Got any questions, Gavin? It's frustrating, huh?
Well, it's coincidental that the process that started this was because they were gonna expand the parking lot for those apartments. And they can't, there's been issues with setbacks. All that's been binned. They're not going through with all of that anymore. 'Cause there's too many problems with septic and setbacks and land and so what started this is now gone, yet there's still the issue there that we know about. We still know about this problem, so.
Yeah, and I don't know if they are related, but it was originally brought to our attention because it was something to do with their master insurance. In order to renew it, they had to do electrical inspections. And so an electrician was actually going around and doing inspections of each of the units and upgrading them accordingly. And he went into this particular unit and just said, I can't go in here.
Yeah.
And what Gavin might not know is that most of our information on these usually come from the police or fire department.
Yeah.
You know?
Correct,
It's not that, we would know any other way.
Right,
And this came from an electrician.
yeah, perfect.
All right, Rick, I'm sure you will, our next meeting, have good news for us.
Hopefully, yeah.
Okay. And what do we get next?
We don't have anything next for Rick.
No.
You've got some invoices and some minutes, and that's about it.
That's about it. Rick, you're all set?
So the only other thing I had was just, I wanted to talk about the budget real quick.
Oh, that's right, the budget.
As you know, Littleton has chosen to leave Neshoba, and what implications on the budget that will have, I'm not too sure. I know Jim is currently working on that, Jim Griffey. And the other thing is that the 2020 census numbers came out, so we tried to base our assessments on the most current population info, and the assessments are based on a per capita number. And so the last time we had done it was for the 2010 US Census, so it's kind of a couple of things going on. One is that those new population numbers are coming out, where Townsend falls and how it potentially affected, I'm not too sure. But Jim Griffey had said that he would be getting an email out to all of you with kind of some numbers, a couple of options on how to deal with the budget. And I believe that meeting of the Neshoba Executive Committee is scheduled to take place on January 6th, and it's going to be on Zoom. So we'll be sending out all of that information to you.
I already
just
got
wanted
it.
to make you guys aware because it is pretty different from years past. You've always been invited to take part in those meetings. I don't think anybody has ever that. But there are some bigger implications this year, and I just wanted to let you know and suggest that you do take part of them if it's possible.
So if, well, we'll just throw this out there because this is probably close to very accurate, is Townsend's population has dropped since 2010?
Okay.
So does that mean you're gonna reduce our payments?
Potentially.
Yeah,
that's
right.
what happened the last time is the towns that went up in population, their assessments grew, and the ones that went down or stayed more stagnant, dropped. And so, if that is the case and other towns have grown, then more than likely that number would benefit Townsend. The Littleton portion, I have no idea, and so I've got to defer to Jim on that one.
Yeah, I know, I don't think it's fair to us as a town to try and make up the cost lost by Littleton, because that has got nothing to do with us. That is
Sure.
totally on you guys to go find a new client, not to look at us and go, well, you gotta pick up the slack because Littleton left.
And I guess that's why I'm urging you to take a part in it, because I don't know if that's true or not true. I really, I work for Neshoba, but that part of it's out of my scope.
Is that a Zoom meeting, Rick?
Really
Yes,
the
it
person
is.
that you need to speak to.
Yeah, it is.
Can I attend it?
Yeah.
You could as just, an attendee. The board members are members of the Neshoba, your board, and so they could take part in it, but, you could attend as an attendee.
Okay.
Do you have that information?
No.
I'll get it to
Yeah.
you if you want.
He's
No,
got
I have it. I have it. I can give it to Gavin if he wants to attend also. I'm going to do my best to be there.
Okay.
I just don't see why Townsend would need to pick up any extra slack for a lost client of yours that doesn't affect us in the slightest bit.
What time is that out on Friday? It's on the 6th?
Let me look it up. Gmail. Okay, hang on, let me go back.
I'm scheduled to work and for the game, but.
Oh my God, Carl, I have so many of these I didn't even read yet. Most Carol, budget capital, Rick Stacy, COVID. Hysteria, weekly report.
Rick, do you know when the meeting is?
I didn't even know that he had sent out those emails yet, so.
I actually got it in a letter from, I got it from in a letter from, Jim. So I have it, I will get it to everybody, so,
Okay.
yeah,
I'll remind you.
thank you. All right, so that's all we need from you, Rick?
I believe so.
All right, thank you, sir.
All right, have a good night.
Thanks,
Thank
Rick.
you.
Have a good night.
Okay, so we have invoices, Carla.
Yes, just a couple. You have my December travel, you have a Staples invoice, I have some arthritis in my wrist, so I got one of those gel little
Oh, nice.
things. Oh, it's wonderful, I can't tell
Oh,
you how much it
that
helps.
wrist thing works great?
Yeah, it really does help,
Yeah.
plus I'm also going to physical therapy. And then we have a Weston and Sampson invoice for just a little bit of miscellaneous work that they did,
Yeah,
and then you have your minutes.
Yep.
Gavin has already approved those ones, if you wanted to look at those.
I actually already read them, so I have no problem with it. There you go.
Okay, you have a couple right there.
Yep.
I believe you have two.
I have two, and I have looked at them, so. There you
I
go.
don't have any really recycling center updates right now, other than the fact that the place is just rocking with,
Yep.
revenue. Our revenue for November for trash bags was $2,600.
Did Paul tell you it came
No,
Saturday?
no, he didn't. What did you think of the place?
Looked a lot better.
Yeah,
Yeah,
good,
it's getting there.
Yeah.
good.
I said that.
Oh, that's your signature, okay.
Yeah,
And
I
is that
brought a
yours too?
couch in, I'm good. we brought a couch, me and my son, Brody helped me. We took a toboggan out of the, swap.
Oh,
Oh,
I
did
saw
ya?
that, yeah,
Nice.
So,
yeah, good.
yeah, put it out with my Studebaker. And the presents. Have you driven by and seen that?
I have not.
Yeah,
Yeah, looks
I
pretty
really
cool.
have to.
you drove by, saw
Yeah,
it,
it's
yeah?
pretty neat.
Yeah, drive by.
Has
Looks
anyone
good.
ever gone down to Littleton, when you're on Highland Street, right before you get to the center of town, the old guy that used to sell the apple cider?
Yeah,
And he has all those old vehicles in the back and stuff, well, I think they've passed away, cause there's been a dumpster there, and every
Yeah.
couple of days, there's a little trailer, and it's got some type of metal that they're getting rid of, and he's got 2 old machines that, they're like tractors and stuff,
Oh,
and they're
wow.
up in the front, and then they've got it wired off,
yeah.
saying, cameras, you can't touch this stuff, so you should go look at
Wow,
that.
I will, I'll have to.
There you go.
Yeah.
Okay,
And that's
so,
all I have.
yep.
I would like to suggest to the board that your next meeting on January 10th be Zoom, where the numbers are so bad and you are having people.
Yep.
It's important, and it would give Jim the opportunity to come in and he could possibly see things if we don't get the full-size plans. I know it's not your favorite thing to do, but given what's going on, I think it's probably the safest.
Probably is, Carla.
Okay?
All right, now you have a company computer we can use, I
Okay.
assume?
Yes.
Oh, good. All right, as far as the work session goes, we have nothing on, recycling, the annual flyer's been pushed. Future agenda items, the septic regs are pushed out till spring, same with stable regulations, 3-wheeler road manure plan. I
That's-
thought they were coming in, what happened?
No, they are for the next meeting.
Oh, the
See,
10th,
It's scheduled
okay,
for the
yep.
10th.
And, fees and schedules,
Okay.
that's for February, and our next meeting's on the 10th at 5:30. We will, include that into a Zoom,
Yes.
okay?
Okay.
Okay, can I get a motion to adjourn?
I'll make a motion to adjourn at 6:26.
I'll second that, all in favor?
Aye.
Aye. Well moved,
Ah.
thank you.